As we discuss the tape on the skin, one of the biggest components, again, is skin safety. So before you apply tape to your patient, they must know how to take it off, so that if they take their tape off at home, they're doing it safely so that they won't have any skin irritation or any skin injury from removing the tape. Any type of tape can do this, but specifically if you're learning taping techniques, you need to learn the proper technique of removing the tape and teach that to each and every patient and athlete that you place tape on so that they don't injure their skin taking it off. And as we discussed in the skin preparation segment, if you are placing tape on the skin, it must be clean, it must be dry, it must be free of oils or any of the lotions that you were working with your manual skills, and that skin has to be cleaned off. That is very true. But if oil or those type of products will keep the tape from sticking, then that would be a wonderful product to help remove the tape in a very sensitive skin patient, such as your pediatric population or your geriatric population, that are appropriate for taping because their skin integrity is good, but you just want them to have less irritation as you remove the tape. Another clinical patient population that's extremely important in is our patients with CRIPS or RSD. You would always soak the tape off with oil. So the technique I'm going to show you for everyone else is not appropriate for CRIPS or RSD. Those patients must soak the tape off with oil. And a baby oil, suntan oil, any type of product that has an oil base. If you have massage lotions that have an oil base to those are fine as well. Baby oil is probably the most common. And if you use it on your pediatric patients or your small children, they're used to the smell of baby oil, so they don't get a little bit apprehensive about a new product coming close to them that they're not familiar with. Now we're going to show you how to remove the tape that is vitally important for you to show each and every patient, client, or athlete that you place tape on so that they do not irritate their skin. So we're going to apply the tape, and as I apply the tape, this is going to be a muscle technique, just as a shortcut reminder. And I'm just going to peel the tape off the paper, and I have a nice muscle technique. Now that muscle technique was wonderfully applied to my skin, and I can teach a patient to do the same thing that easy. So when I apply that technique, I have not yet rubbed it. I have not given it a friction rub because I like my skin. And I do this often. So I'm only going to take off as much skin as I need. So if I want to remove the tape, and I show this to every single patient, if you take the back of the tape and you peel just a corner and you put it on the back of the tape, then if they peel their skin from the tape rather than the tape from their skin and just pull it off, but if they peel the skin from the tape rather than the tape from the skin, they'll have a much different response. But I can do it again, okay? So as we teach our patients how to remove the tape from their skin, it's incredibly important that they understand the damage that can be done. So I'm going to do another piece of tape to show that. The last piece of tape was simply you turn the back of the tape to the back of the tape and you peel the skin from the tape as you accomplish removing the tape. Again, never any stretch on either end, and I can just pat the tape down. Now with no friction rub at all, that tape is pretty stuck, and it's been 0 minutes. So when I go to take this tape off, if I were to just have a relaxed skin position and I were to pull up the tape, and this is without any heat from my body making this tape stick longer, I would pull my skin right up. And you want to show that to each and every patient, that if you pull the tape off your skin, you will rip your skin off, and it can be very injurious. So we want the patients to keep the stretch on the skin, just like when they put the tape on, put the back of the tape on the back of the tape, and then peel the skin from the tape. When you get to the area where your hair grows, you want to go with the direction of hair growth, and it's much more comfortable. So I can just let this fly, and look how much less sticky it is now. And it was only on my skin for 20 seconds, 30 seconds, and it's not very sticky at all. Once I get skin cells on the back of this tape, on that adhesive, it's not going to stick to me again. So it sticks very well once, that's it. So if you get your skin cells on the tape while you're trying to peel the paper backing off or while you're applying it to your patient, it's not going to stick to your patient. The other thing is, if you go with the hair growth and the back of the tape on the back of the tape and peel the skin from the tape, not the tape from the skin, it's much more comfortable to go with the hair growth. So when we're clinically determining when we would like to use tape, that's a clinical decision based on your evaluation of your particular patient, client, or athlete. So as we are presented with that athlete, that client, or that patient in our clinic, we have to determine what treatment is appropriate for this patient. Taping may not be part of that paradigm. However, if it is, you need to go through the same musculoskeletal evaluation and clinical thinking process as you did whether you're going to use ultrasound for that patient, if you want to use a modality at all, or are you going to go to manual mobilization, soft tissue skills, whatever you're going to do with that patient. So that patient paradigm and thinking process clinically should include a musculoskeletal evaluation, which is complete, and by the end of that evaluation, you as the clinician need to know what tissue is involved in my patient's problem, how irritable is that tissue, what stage of healing is that tissue in, and now I can determine what type of tools I have in my toolkit as a clinician in order to address those problems. Again, if you do not do a good musculoskeletal evaluation, you have no idea where to start with patient care with anything, let alone if tape is a portion of that treatment. If I have tape on for facilitation of a muscle or inhibition of a muscle, that will be at two very different times of my patient's treatment process, or my athlete in their competition versus a training phase with an injury. So I need to know exactly what stage that patient or that athlete is in before I determine how I want to place that tape on their body. Do I want to place it for pain control and a pain-specific strip with a Band-Aid? Would I like to get rid of some of the edema if it's present and tape for edema? Or would I like to facilitate or inhibit a muscle to either rest it in an acute phase, or do I want to facilitate it while they're in the rehabilitation phase? So once again, to determine that, we need to know by my musculoskeletal evaluation, what structure of my patient am I dealing with? Specific structure, not low back, but facet joint. Is it a disc? Is it capsular? Is it muscular? Specific tissues involved, the stage of their irritability, the stage of their healing, and then I can make a clinical decision as to how to progress with that treatment, if tape is an option, and which taping technique I would like to choose for that particular patient on that day. If my patient does not change in my treatment from day to day, I need to think of another treatment plan. We want to see changes in our patients. We want them to progress through their stages of healing throughout their rehabilitation. If that is not occurring, you need to change your treatment options. You also need to treat with tape in a different mode. So if I was taping for inhibition, maybe now I need to change to facilitation so that patient can exercise and progress with their exercise program more quickly. It is your choice as a clinician how you choose to treat your patient and if tape is part of that. If it is, then you choose which taping technique is appropriate for that treatment on that given day. When we're talking about one of the unique qualities of light elastic taping, we can use our tape to help us drain areas of lymph fluid, swelling, edema, whatever it is we're choosing to call it, depending on the proteins and the products within that liquid that's in the interstitial fluid. So we're going to call that swelling, just for ease of talking about it. So when we're talking about swelling, there are light elastic taping techniques that we can use that are very helpful in draining the fluid that is there. When we're talking about treatment options that are already out there that have been used for 80 years, hundreds of years, compression has been used since the beginning of patient treatment as a written documented process. So if we compress with an ACE bandage or any types of wrappings, which the edema schools teach, that will keep swelling, more edema from coming into the area. But when we add the process of light elastic taping for edema, specifically the edema techniques, it actually gives us a way to drain the fluids that are already there. That's something we could never do before. So we could help the fluid from not collecting as much and not being released into the tissue, but we didn't have a way to drain what was already there. So in our lymph taping techniques, we will discuss how to apply the tape to a patient to assist that process in the positive-negative pressure system flow that we understand as going to school in physical therapy, certified athletic training, chiropractics, in our paradigms that we have learned how the lymph system works with a positive-negative pressure system, and we're going to show you how to use that with the convolutions of the tape in order to get lymph drainage rather than just compressing something so that no more fluid comes into the area. By being able to do that, we've had a much better end result and a much better patient process of being able to exercise. Even while that edema is starting to clear, it actually helps them to have range of motion while this tape is on. So as we process this and learn more about it clinically, we're going to go ahead and show you how to do it. And to get the finer details, would advise registering for a class so that you can actually get your skills and your handling techniques of the tape, specifically for edema, that is ultimately important to not injure your patient while they're in an inflamed mode, to go ahead and come to a class and learn the details of that technique. But we're going to show you how to do it here so that we can get you started and help your patients to decrease that edema so you can get on with your treatment program and your rehabilitation.